I want to welcome you all to our VCSQI spring meeting. VCSQI, the Virginia Cardiac Services Quality Initiative. We are a nonprofit collaborative of cardiac surgery and cardiology providers across the Commonwealth of Virginia.
We work with member organizations, hospitals, local hospitals, physician practices, just to help them improve care for their patients.
We need the smartest folks at each of our centers collaborating to share data, to share best practices, and improve patient care. We do that via collaboration, we do that via data sharing, we do that via meetings like tonight.
We use the data to benchmark each other, to see who's performing well, not performing so well, where there's opportunity, and it's a network.
We can go in and say, okay, Hospital A is performing really great at this measure, whether it's 30-day readmissions, AKI, we track, dozens of measures across the different registries. Sherry and I interview them and say, hey, what have you guys done to move the needle? Why have you improved so much? And they'll say, well, here's a protocol we're using, here's the steps we're taking. We'll often form a work group and get people together reviewing those protocols and say, okay, here's what we want to take, and kind of distill that down into a VCSQI best practice, which can then be copied and pasted across the other centers. So, Hospital B can now implement Hospital A's protocol, plug that into their system, and hopefully see the same types of improvements that Hospital A had.
One of the metrics that the federal government tracks is readmission to the hospital after 30 days. When I became involved in VCSQI, they said, would you like to do this as a project with us? So we took all the data, we took all the interventions that are done, we polled and surveyed all the hospitals in the state and say, what do you do to prevent readmissions? Sherry developed a stoplight with red, yellow, and green. Green meaning low risk, red meaning high risk, and we use it at our hospital. Every patient that goes home has the stoplight in their chart, and it says whether they're low, medium, or high risk for readmission, and then we change what we do. If someone's a high risk, we call them every couple days. How you doing? Why don't you come to clinic earlier? Let's get involved earlier to make sure you're not bouncing back into the hospital. Yeah, it works well. It works well.
In the late 80s, managed care came into our metropolitan area. It became incumbent on us to begin to practice differently. And what I thought is, why not get together with some of the bigger programs in the Commonwealth of Virginia and start sharing our clinical information, but also combine it with costs, which no other database had done in the United States or in the world, really. We were able to show by this collaboration with all of these institutions how to truly drive wonderful outcomes, reducing transfusion, for example, with heart surgery. Most hospitals in the United States transfuse over 62%. Ours was 11%. And we saved in 18 months $44 million by reduction of complications for that one entity. The power of how to collaborate became an unintended consequence that we sat down and said, okay, we can do this. It was a passion, it was a commitment, and people were really living it. It's the old Bill Gates thing, if you want to improve something, measure it. We measured it to the nth degree.
I founded an organization in 2008 called the Virginia Heart Attack Coalition. What we determined was that where you lived had an impact on whether you lived. Several years ago, we joined forces with VCSQI. To us, it doesn't matter if you're in a rural county in Southwest Virginia or in an affluent county in Northern Virginia, if you're in an inner city area or a wealthy suburb, every patient should have access to that state-of-the-art care. VCSQI has already begun to close that gap, bringing these individuals together to share best practices, to look at their data in comparison to neighboring healthcare systems, populations of patients. That's ultimately how this rising tide is going to raise all boats.
VCSQI is definitely a valuable resource for any site that wants to improve their care or to learn. And it's also for the data managers for the database. It's really important that our data has integrity, that we're all coding the same way. Having the data back behind it for research and improving care is really important.
I'm a data science person by trade, right? So it makes a spreadsheet and it turns it into a collation of real people. Each row in that database is a real life. They have a real family. There's a real story behind, what caused that person to end up here and then what is causing them to get better. So it just really personalizes the entire experience.
I love coming to the meetings because I love seeing people and I love talking to people and I love learning what other people are doing. And the benefits of being part of a state organization is that you're not isolated. You're not a silo out there by yourself. We're all here to help each other and to help the patients. We all get better, and I think it's all about improving, and it's definitely worth it. It's worth it. We have so much to offer as a group.
VCSQI membership will improve the quality of patient care at your institution and also save your institution costs. It'll be a win-win for you to join.
To interact with the patient, to be with the patient, you have to have people that want to do it. VCSQI has members that are really interested in doing this. They're interested in getting their data and saying, how can we make a difference? They really empower hospitals, empower individuals at these hospitals to intervene, to go to their surgeons who are much too busy to be going to a lot of meetings and saying, hey, here are some things that are done other places that work, that make the care better for patients.
These are ambitious people. These are mission-driven people. These are people who care about other human beings. Goes back to the idea of this being a public health organization with care of people and their hearts at the core of it all.
These organizations here in Virginia, they work together. And when you have that kind of commonality and that kind of passion and heart, that's all you need.
To put this into place and see it evolve over time and watch it continue to get its own energy. And people have come and gone, but it's never stagnated. People didn't just dribble off the court and figured, okay, we've done enough now. But name me an insurer that's ever done that. Nada.
Most of us got into healthcare to take care of individual patients. But I would say that it is even more satisfying to take better care of a whole population of patients. All the things that VCSQI is bringing to the table, that's what allows that to happen.
Heart disease is the #1 killer in America. People need this service. It's vital, and it all comes back to improving patient lives, giving people more time with their families, and just understanding how we can just keep getting better at what we do.